So, I mean, you talked to me before about this and the guiding points. You mentioned that again about you say it is important to learn this, what has happened before in history,
Hmm.
psychiatry's history, because if we don't know our history, we are bound to repeat it. So, is this
Yes.
something that new psychiatrists are they aware of the history of their own field, or this would be new to
I
them?
think that these things are put in the past. It's
Oh,
like they don't want to remember the treatments and the beliefs that
yeah,
really backed them up. It was pseudoscience, to say the least.
right.
Like in the Trenton State Hospital, there was a doctor there named Henry Cotton, and he believed in this idea of focal sepsis, which meant that inflammation or infection in the body caused mental illness.
Yeah,
And a lot of doctors went along with it, even though it wasn't scientific like we would say today.
right.
But psychiatrists wanted to be known as researchers, and they wanted to be known because they had the reputation in these mental institutions
Right.
to know more about the cattle there, because they grew their own food and they had their own farms and they had their own gardens, and that's where the people from the institution would work. So they knew more about how many cattle they had than how many patients they had, and more about the care of the farm. So they wanted to really be known as real doctors, and not just people who were kind of doing custodial care, because there weren't any treatments
Right.
except hydrotherapy, or really more like torture than
Uh,
treatments. So that's when they decided to have this research, and also the electroconvulsive therapy that we're talking about was cheap. Electricity was cheap, and so you could get the results right
uh,
away, and also you could affect all the patients on the ward, because now they became docile, and you could talk to them, and so that response was seen as, oh, this is really working, you know, to help these people. And that wasn't the case, because first of all, it didn't last very long if it was effective at all, but
right.
it could be used on a lot of people. So when they don't want to look back to this era, I call them the somatic treatments,
Yeah. Yeah.
but they lasted a pretty long time. So with Henry Cotton, what he would do, and this is one lady that I mentioned in my book. Her name is Martha Hurwitz,
Right.
and the great Andrew Scull, who's a social historian, talks about it in his books. And she was a woman who was told that she has a mental disorder,
Yeah.
and she was in the hospital in Trenton State for, I think, 54 years. And because of this focal sepsis, she had all her teeth pulled. That was one of the ways to treat mental illness. And
Wow.
she had all these treatments and neuroleptics when they came about, and also malaria fever therapy. And just for like 54 years, they tortured this poor woman. And that she didn't die from mental illness. She died from a fractured hip and then pneumonia and big bed sores and the like. So I call her in my book the posthumous wrestling New Jersey wrestling champion, after all the things
Yeah.
that she went through and wrestled
Wow.
through
Yeah.
in her life. And so she was emblematic, I think, of a lot of people who were in that situation where they went into a mental institution, and then you're not taught any skills. And besides that, the treatments were less than scientific. So that literally, like with insulin shock therapy, the idea was to make your brain anoxic, meaning it didn't have oxygen, up to hours.
Wow.
And that was supposed to help you to forget your memories. Well, it also shrunk your brain, these treatments. And that's why psychiatrists are still called shrinks.